Medical Gross Anatomy Lab 1. The lower limb. The lower limb is divided into 4 parts: the hip, the thigh, the leg, the foot. The hip is a region lateral to the gluteal regions, and it's inferior to the iliac crest, overlying the greater trochanters of the femur, whereas the thigh is the regions between the hip and the knee. The leg is the regions between the knee and the ankle. The foot is distal to the ankle. As you can see here, the hip, the thigh, the leg, and the foot. Okay. Now the functions of the lower limb. The function of the lower limb is for weight bearing, for locomotions, and maintenance of equilibrium. Dissection Overview. What do we want to remove? So we're going to remove the skin, the subcutaneous tissue, the fat. And what do we want to preserve? We want to preserve the superficial fascia. We want to preserve the superficial veins. Most importantly, the great saphenous vein. And we also want to preserve the cutaneous nerve. So what is the great saphenous veins? Why is it so important? The great saphenous veins, it's previously called the long saphenous veins, and it's a large subcutaneous superficial veins of the leg, right here in blue, and it's the longest vein of the body running along the length of the leg. It runs along the medial side of the leg right here. So the great saphenous veins originates in the first dorsal veins. When the first dorsal veins right here of the first digits merges with the dorsal venous arch of the foot, so the dorsal venous arch of the foot is right here. When it merges with the first dorsal veins, the dorsal veins of the first digits right here merges with the dorsal venous arch, and that forms the saphenous vein, the great saphenous veins right here, and that vein will courses anterior to the medial malleolus. The medial malleolus right here, like your ankle right here, it will go anterior to that, and then it will course upward right here onto the knee, where it will courses posterior to the medial epicondyle of the femur. So the medial epicondyle of the femur is along the knee area, and it will go courses posterior to that epicondyle. And then the great saphenous veins then will course anterior, and it lies on the anterior surface of the thigh before it enters the opening at the fascia lata, opening, which is called the saphenous opening, and it would join the femoral veins. Which joins the femoral vein right here in the femoral triangle. Well, the femoral triangle will contain the femoral vein, artery, and also the nerve right there in the femoral triangle. The clinical correlations of the great saphenous veins. So we see that in certain patients, who have undergone coronary bypass surgery, we are unable to locate the great saphenous veins because it is often harvested for that procedure. So they took out that great saphenous vein for the coronary bypass, so we wouldn't be able to locate that in those patients, locate the great saphenous vein in those patients. For the dissections of the anterior hip and thigh regions and also the posterior gluteal region. So first the anterior hip and thigh. So we want to locate the superior iliac spine and the pubic tubercle. So here is the anterior superior iliac spine and the pubic tubercle. And connecting those two is the inguinal ligaments. Here's the inguinal ligaments connecting both. Okay, so we want to make a cut. So we want to make a cut along the inguinal ligaments from here. So from the anterior superior iliac spine right here to the pubic tubercle right there. And then we also want to extend this cut around the medial side at E right here, the medial side of the thigh to the posterior surface of the thigh. And next, we want to make a vertical incisions right here, number F, from the midpoint of the inguinal ligaments. So the inguinal ligaments, so we made a cut right here. So midpoint of that, we make a vertical cut from here down to the patella. So after we make that cut, we want to make another cut, a transverse cut along the patella, so that it's easier for us to make a cut along this area to remove the skin. So the next step is to remove the skin, subcutaneous tissue, and the fat. And we want to locate the great saphenous veins on the medial side along this area right here of the thigh. And we want to be very careful not to damage it. And be very careful with removing those superficial tissues and subcutaneous tissues. Watch out for those veins. So next, after we've done with the anterior thigh and hip, we want to go to dissect the posterior gluteal regions. We want to turn the donor into a prone position. Probably need a couple people to help turn the donor into a prone positions. And we want to make a midline incisions here, and we want to work from the medial to the lateral side right here, and make another incisions along the gluteus maximus muscle. The gluteus maximus muscle is the largest muscles, the gluteal regions right here. We want to make an incisions right there, and we want to detach the skin from J. J is right here to K, and then we want to put those tissues that we have just detached into a tissues container using the bag, the black bag that is given to us, and put all those tissues in there, and it will be kept with the donor at all time. And so after that, we want to remove subcutaneous tissues and fats until we reach the gluteus maximus right there.